Uh, Good morning, all. Today's topic is on fibrous dysplasia. So, fibrous dysplasia is a congenital skeletal disorder where the normal bone is replaced with a fibroosseous tissue, which has an irregular trabeculae of woven bone and are haphazardly distributed. It can affect either single or multiple bones. Other names include fibrocystic disease, focal osseous fibrosa, fibro-osteodystrophy. The main etiology of pathogenesis is nothing but the mutation of GNAS1 gene, that is guanine nucleotide binding protein. It can affect, the mutation happens in the embryonic period, and it can affect all three germ layers, which is seen in McCune-Albright syndrome. If one or two germ layers is affected, it is polyostic type of fibrous dysplasia, and the mutation happening at postnatal life is a monoostetic type of fibrous dysplasia. Coming to the types of fibrous dysplasia, it is monoostetic fibrous, polyostetic, which is further subclassified as Jaffe-Lichtenstein type or McCune-Albright syndrome. And the third one is a craniofacial fibrous dysplasia. So in monoostetic fibrous dysplasia, one bone is involved. When there is a more than one bone involved, it is polyostetic type. In Jaffe-Lichtenstein type, more than one bone with pigmental lesion, that is capheo-like spots are seen. In McCune-Albright syndrome, more than one bone, pigmental lesions, and endocrine disturbance are observed. So, summing up the clinical feature, it is slowly progressive painless enlargement of bone. It is mostly diagnosed before 30 years of age, and it can affect both sexes. Maxilla is more predominantly affected than the mandible, and maxillary posterior region is more affected than the anterior region. Monoostetic type is 6 times more common than the other type. Lesions are often found unilaterally. So monoostetic type affects maxilla than the mandible. Polyostetic type affects the long bones, ribs, and skull. So Jaffe's type, it can affect multiple bones with a skin pigmentation. The skin pigmentation is known as capheo-like spots, that is coffee with milk appearance. The hyperpigmented macules is well defined with the irregular border. The color is medium to dark brown in color. In McCune-Albright syndrome, more than two bones are affected, and there is a presence of abnormal skin pigmentation along with endocrinopathy, mostly precocious puberty. Other endocrine abnormalities that can be observed are acromegaly, gigantism, diabetes mellitus, hyperparathyroidism, hyperthyroidism, and some more. This is the features classical triad of McCune-Albright syndrome, which includes precocious puberty, capheo-like spots, and polyostic fibrous dysplasia. Craniofacial dysplasia, it is a lesion which involves a group of contiguous bones separated by sutures like maxilla, zygoma, sphenoid, and occiput. The craniofacial lesions may lead to anosmia, that is loss of smell, deafness, blindness, and proptosis of affected eye. Dental anomalies like rotation, oligodontia, that is multiple missing teeth, displacement, enamel hypoplasia, hypomineralization, and orthodontism can also be seen. There will be a palatal and facial asymmetry, expansion of buccal and lingual cortical plates are seen, and the superior displacement of inferior alveolar nerve is observed. So coming to the investigation part, in the serum examination, the serum alkaline phosphatase level is elevated. In case of McCune-Albright syndrome, there is high level of growth hormone, prolactin, and thyroid hormone. Radiographic feature, the common feature is a ground glass or granular appearance. There will be a narrowing of pedial space and loss of lamina dura in the apices of the teeth. If the mandible is involved, there is a multilocular radiolucency due to optical illusion, and there will be an expansion of cortical plates and bulging of the inferior border of the mandible. In maxilla, the obliteration of the maxillary sinus floor is seen, involving the zygoma and infraorbital margin. Craniofacial fibrous dysplasia shows thickening of the occiput and base of the skull. So based on the maturity of the lesion, radiographically it is classified as early lesion, mixed lesion, and mature lesion. The mature lesion has an orange peel or powdery orange appearance or thumbnail or fingerprint appearance. Malignant potential rare. Rarely it can malignantly change into osteosarcoma. So these are the radiographic pictures showing the ground glass appearance or granular appearance with the displacement of the teeth and loss of pedial. So in this picture, there is the involvement of maxillary posterior region, where there is an obliteration of the sinus floor and the granular appearance of ground glass appearance of the maxilla. So coming to the management part, a small lesion can be closely monitored and follow up is sufficient. Superficial contouring if needed. A large lesion requires curettage and surgical contouring for aesthetic concern. Radiotherapy is contraindicated. Recurrence, complete excision of lesion with, if there is a recurrence, complete excision of lesion with reconstruction is done. So summing up the whole, it is replacement of a normal bone with a fibroosseous tissue. Mostly maxilla is affected, maxillary posterior region is affected than the mandible. It can be early diagnosed in 30. It is due to the mutation of GNES1 gene, and there are 3 types. The radiographic appearance of granular appearance, thumbprint or orange pill, ground glass or cotton wool appearance. There will be, in case of craniofacial fibrous dysplasia, it can cause superior displacement of the inferior alveolar nerve. Thank you.